On tonight's show, find out how to avoid a heart attack.
Plus, the do's and don'ts when performing CPR.
Thank you so much for joining us for another episode of Everybody Knows. My name is Mike Kasem, along with Catherine Roberts.
Mike, did you know that according to the Singapore Myocardial Infarction Registry annual report in 2021, more people in Singapore are actually getting heart attacks, with the number rising from about 8,000 in 2011 to about 12,500 in 2021.
Those are pretty alarming numbers, but the good news is a lot of heart attack cases are actually preventable.
And joining us to shed light on the causes, prevention, and treatment of heart attack is Dr. Pinakin V Parekh. Come on out.
Hello, guys. Thank you for having me on the show.
Thanks for coming out.
No problem. Catherine, I'm very impressed. You got my name very nicely right. Thank you very much.
I was so nervous about that.
You were okay too, Mike.
So do I need to roll the R a little bit, Parekh?
Whatever floats your boat, Mike. Whatever floats your boat.
All right, so great to have you here with us. Now, Dr. Pinakin, the average size of an adult heart is about, the same size as a fist, right? So why don't we take a look at this heart model in front of us, and then you can explain to us about what is considered a healthy heart.
Definitely. Mike, you say it's the size of a fist, but it packs a mighty punch, okay? So the heart, it's, as we know, is the most, or rather, I would like to think the most important body part of the body. Everyone knows that. And I tell patients that this is like the engine of your car. It's going to run very well for years and years, provided you maintain it, you take care of it. So think of the heart as your house. Your house you live in, there are 5 parts. Number 1 is the walls of your house. You've got all these 4 walls. So the muscles of the heart are important. They constitute the outer layer of the heart.
Okay.
Number 2, we've got the plumbing of your house. We want to make sure your plumbing is not choked, it's free flowing. So if you've got the blood supply, that's your plumbing of your heart.
Okay.
Number 2, you enter your house, we've got 4 chambers of the heart. 2 on the left, 2 on the right, and these chambers are responsible to make blood flow in one direction within the heart and get pumped out to the rest of the body. And then in between chambers, there are this thing called one-way doors, and they are responsible to prevent blood from not going backwards. And this is like the electrical supply of your house, and that's important for your rhythm. 60 beats, 70 beats, 80 beats. When you run, it increases. So any one thing inside any of this, you can have a heart problem.
So I think some people are a bit confused about the difference between a heart attack and a cardiac arrest. So what is the main difference?
So cardiac arrest is when there's some major upheaval in the electrical system of your heart. Your electrical system becomes too fast, chaotic, or too slow. And when that happens, your heart can't function well enough to produce any blood supply for the body. The end spectrum of cardiac arrest is switching off the electricity. The heart stops.
Right. And what causes that?
One of the causes of that is a heart attack. So when you have your blood supply compromised, not enough blood down the artery, the muscles get starved of nutrients and oxygen. They kind of get damaged. And when the damage is extensive, it causes electrical problems, and then you can get one of the electrical upheavals. So cardiac arrest, big overarching term, heart attack, one of the causes.
Okay, so Dr. Pinakin, what are the symptoms of a heart attack between men and women? I feel like it's different. It has to be different, right?
In females, sometimes the symptoms are not as apparent. And there are many factors for that. Hormones play a part. The estrogen, the female hormones, kind of make the symptoms perception a bit different. The pain tolerance of a woman can be different. The arteries, the microcirculation of the heart is different in caliber and different in size.
Okay, well, awesome. This is a great start to what's going to be a fantastic conversation. Let's go ahead and invite our guests out. He is a diehard Man U fan.
Ugh, so annoying.
You know what I'm saying? Yeah. He loves jogging, while she is a popular all-rounder who can't seem to get enough of dancing.
don't tell me. Perhaps, perhaps.
Alrighty, perhaps we should welcome our guests, Joakim Gomez and Xixi Lim.
Okay.
Hello, guys.
Well, now you're all smiles. Smiles with the earlier with my favorite team. Hello.
Wait, you heard all that?
Yes.
Yeah.
Oh, we didn't think you could hear back there.
Pretty clear.
United fans, the exit is there.
Okay, I'm going. No, no.
So guys, I'm also going to.
United fan. What? Do we sit? Do we stand?
Yes,
let's take a sit.
Let's have a seat. Now, Joakim, you like to sweat, right? You like to run. So,
Yeah.
before we even get comfortable, we actually want you to do some skipping.
Okay.
Right now?
Yes.
I
right
actually
now.
have something on my chest. I feel very tracked.
Yes,
some strange
we
reason.
have been tracking you.
Okay.
But now we want you to track your skipping.
Okay, do I do it now?
So what
Yes.
I've done is earlier backstage, we put in ECG monitor for him, and that's going to track his heart rate. I've got it paired to my phone. I know your baseline rhythm now.
Yeah.
After exercising, let's see how much it goes up to.
And then also, we want you to sing while you skip, you know?
No! Come on.
That's tough.
Do I go extremely fast or normal pace?
Gradually build it up.
Okay,
Yeah.
okay, here we go.
Okay. Slow and steady.
Watch, I'm sure,
So
right?
74 now, 78,
Oh, that's really fast.
84, 83, 86. So skipping is a high intensity activity.
Okay, he's increasing his speed.
So
Okay,
it's about 170 now.
as his-
Look at his face.
No, yeah, exactly.
80 now.
Before Joakim's calves start giving way, do you want to come back and
Yeah, can I
sit
sit
down?
now? Yeah.
I'll take a
Don't
sit.
do as well, I think.
Don't
Yeah,
you can
that's
come back
right.
and sit down as well? Okay.
So he's back to 90 plus now.
Okay.
Yeah.
We're back to normal. But he
Okay.
still needs that blush.
Yeah.
Makeup.
How do
Massage
you
after
feel?
this.
How do you feel, Joakim?
No, I mean, given that I run regularly, I kind of know how I would feel after a very hard run or easy run. But something that's really intense, like skipping, to go from easy to hard straight away in a few seconds, yeah, there will be a bit of breathlessness, a bit of tiredness. So of course, now that I'm seated, I think I can relax. And once my heart rate slows, let's have a good conversation about this.
He's like
You know,
holding it back.
He can't even talk right now.
Yeah.
You know, Doc, if we exercise regularly, we watch our diet, is heart attack something that can be kept at bay?
Exercising, having a good diet really puts you up for success. That's a good habit. Adopting that early is very useful. But we also know that whatever you see on the surface might not be the true reflection of what you have inside.
Would you say that if you're on a really bad diet and you definitely have clogged arteries, that exercising is probably not even a good thing for you, right? Because the blood starts pumping faster, can't
That's
get
right.
through.
So, let me just show you, since you talked about clogged arteries. So this is the plumbing of the heart that we are talking about. So inside should be clean and open, right? So if you have plaque buildup because of cholesterol deposition, you have something like this inside. This is cholesterol, and that kind of decreases the amount which is open. So some people have a 30% buildup, a 40% buildup. That means 60, 70% is still open. It's enough for your day-to-day activities. But as it progresses more and more without you having any awareness, it can get more significant and you can start having chest pains.
Doctor, for a heart attack, can I just ask, why does it always occur or sometimes occur when it's least expected?
This is something that takes a lot of people by shock, right? Because they never saw it coming. That's because when you have a narrowing, which is about 30%, sometimes because of exercises, this plaque buildup there is not natural, normal tissue. It can have a fissure, it can have a tear. And what happens when you have a tear on your skin? The body tries to heal itself. There's going to be a blood clot, a crusting. But if that blood clot happens inside, you've got underlying cholesterol, we call it plaque rupture. A blood clot sits on it. Previously, you are stable. Suddenly, 1 + 1 is not equal to 2. 1 + 1 = 3. You have a heart attack.
A blood clot, is that floating through the arteries and then it stops at the...
No, it forms on site. So you've got an injury down there, just like you've got an injury on your skin, the blood clot forms on site to kind of repair. But this repair mechanism is dangerous when you have a finite space. Repair mechanism here is okay, but in a finite space is a problem.
In the meantime, we do need to take a break. We're going to pay some bills here, but when we come back, we're going to finish it up with the doctor, and we're going to get to the slides, and Xixi will have some questions.
I will have a lot of questions.
I'm happy to answer them.
We'll be right back.
And if you take medication for high blood pressure or cholesterol, does that mean you are exempt from getting a heart attack?
False? I think it's a false. I think you can't just necessarily fall out of risk for heart attack just because you take the pills.
Welcome back to Everybody Knows. And you know, it's tempting to take one's health for granted, especially when you look and feel as fit as a fiddle.
Oh, okay. 66-year-old Arbeláez Hernando swims, plays tennis regularly, and takes part in marathons. But he received a rude shock when he went for a full-body medical checkup last year. And here's his story.
I feel blessed to be alive every day of my life.
It's hard to imagine that an active and sporty person like 66-year-old Arbeláez Hernando, who plays tennis 3 to 5 times a week and jogs twice a day, almost felt like he could have lost his life on the operating table last year.
For the past 20 years, I've been trying to keep my cholesterol down and do a lot of exercising. However, I felt like I was doing everything right and I didn't have anything to worry about. I started running marathons and running more regularly. So I was very confident that I was in good health because I was able to run a marathon. I was a football coach, so I was always very active and involved in sports. High cholesterol and heart condition runs in my family. And so my father died at the age of 72. 2 of my uncles died of heart attacks as well.
My persistence was always there for him to have his checking the cholesterol. Often the results came high. At one point he took medicine, then it came down. I'm always very concerned about his diet, what he eats.
My wife suggested that because turning 65, I should do a full spectrum checkup. And I said, okay, let's do it. And I was confident that everything was going to be okay.
It was far worse than I expected. His LDL level was too high. And then after, when I saw also the results of the angiogram, I was like, oh my God, he was so close to have a heart attack.
The blood test taken by the retired pharmaceutical executive showed that his LDL cholesterol was high, and the screening of his heart indicated that the calcium score was more than 1,000. This was unusually alarming, as a score of 100 to 300 means moderate plaque deposits, and having at least 3 times more calcium in the heart also means a higher chance of developing a heart attack in the future.
There's a blockage that forms through the years where there's this calcification that builds up and hardens. So when it gets hard, it starts blocking the passage of the blood through the arteries. My main artery was 98% blocked. When I received the results, I felt scared, I felt anxiety, and I was worried that at any point my heart could stop or I could have a heart attack. I had 2 angiograms performed. 2.5 hours into the procedure, I see a red light and the nurse comes around running around the room, goes behind me and starts pumping me in the heart. 15 minutes later, after the first incident, then again the red light goes up. I see the same nurse comes around, pumps my heart and said, okay, and then she goes back. Next morning, doctor comes to my room and says, Mr. Arbeláez, you know that your heart stopped twice during the procedure? Being alive is a miracle, and we are very sensitive to conditions that we are not even aware of. I appreciate every day more. I appreciate having breakfast with my wife, having dinners, and meeting with friends. My routines and everything has not changed. My mind has changed about how I approach life.
Wow.
That's
Yeah.
pretty powerful.
Doctor, from the video, I actually heard him say he has blocked arteries. But what are blocked arteries and how do we prevent this from happening?
There are many risk factors. So, I mean, apart from your eating right and exercising, you need to check your cholesterol, your diabetes, stop smoking if you're smoking already. And all this add to the mix. A little bit of this, a little bit of that, a little bit of this, all are triggers for propagation of disease. Heart disease, I just want to emphasize, heart disease, there's no physical appearance. You don't see a scar, you don't see a malformation, it's all deep-seated.
Yeah.
So it's probably you require blood test. What he had done is he had gone for a CT screening test of his CT screening test. And that showed blockages in a high calcium score. Calcium is basically a reflection of not the internal narrowing, but the hardening on the elasticity and the muscle wall. So if your artery is very hardened, the effort I need to crack open and dilate my metallic structures, my stents, I will have to use sophisticated tools. For him, we needed to use a drill to kind of shave off some of the calcium to be able to open up my stents to make sure they're round and perfect.
So I probably should have gotten checked before 50 though, right?
That's a bit late. A lot of my patients do start checking in their 40s.
Yeah.
In their 40s, And talking about 50, menopause is a very defining period in a woman's life. That's where, when the hormones decline, the female hormones, estrogen, your cardiovascular disease gets more pronounced in terms of a risk factor. So if I tell my ladies, my female patients, if you've never had time to check your health, menopausal time is a good time to take stock.
If someone who has no family history of heart attack, the chances of that person getting a heart attack are lower?
Family history is just one of the risk factors, right? So many risk factors. So if you take out family history out of the equation and everything else is alike, yes, your chances are a bit lower, provided you don't smoke and the cholesterol is okay. So there are many, many factors for you.
Are those the devices you use?
Yeah, so let me show you how a stent looks like. It's like a spring. So basically, again, just to summarize, blockage, we balloon to pry open the artery.
Okay.
And then you need to put in a stent there to make sure it doesn't collapse back on itself.
And then you
again.
take the balloon out?
And we take the balloon out. The stent remains there for a lifetime.
Xixi, you have any questions for the good doc?
No, I'm very worried and very troubled right now. Yeah. In my heart, I was thinking, okay, I need to go for a body checkup right away.
Stay with us, guys. We're going to be right back with instructors showing us the do's and don'ts when it comes to performing CPR.
Women who are fit will not get heart attacks. Is that true or false?
False. False.
False.
Anyone can get a heart attack at any time, no matter how healthy they are. But it's also preventive. It depends on diet, daily habits.
Maybe if you do some exercises to strengthen the heart, then they may have lesser chance.
It's reported that 1/3 of the population here in Singapore has had CPR training. Kat, are you one of them?
Unfortunately not.
Well, keep your clammy claws off the calico then. Don't touch me. But don't worry about it, guys, because we have two experts from the Lentor Training Center here. We have Mohammed Salfi and Fariz Masan to show us how to administer CPR.
So how do I know if a person that's lying down in front of me is having a heart attack or a cardiac arrest? Will I be able to tell the difference on the surface?
The easiest way to do so is we do a preliminary assessment of the casualty, where we will assess the casualty based on six very simple steps. And it's usually accompanied with a very simple acronym called DRS ABC, Doctors ABC.
Okay. Simple enough.
Okay.
Simple enough.
Okay, feel my palm, center of the chest, lower half of the breastbone, interlace my fingers, lean forward, and I will start performing my compressions.
Well, correct or incorrect?
Placement for my hands. So the heel of your palm, place this right in the center of your chest, right where your lower breastbone would be. Okay?
Xixi and I like, where the bone?
So this upper half, lower half.
Okay.
So I'm going to be right there. Knowing the lower half of the breastbone, I'll continue my compression. So it's important that we press straight down, all right, and not lean back or lean forward, because you want to press right where the heart is.
Okay.
Right? So I'll continue my compressions.
So when you do these compressions, you're kind of providing external cardiac massage.
Yeah.
And that is to help sustain blood flow. So you can see the red color supply to the brain Can you see that? So that's what a good compression
I didn't notice
does.
that before.
You massage, you pump, and it tries to help your brain's survival.
Wow.
Yeah, with no blood pumping to the brain, how long does it take to go brain dead?
Wow, it's very, very short, in a few minutes, actually.
Okay.
Yeah.
Okay.
But I mean, I think a lot of us would try to do it as much as you can until you are tired. You can get a second assistant to come in, who's probably coming now with the AED.
Is there like any sort of precaution?
If you ever get a chance to see CPR being performed in real life, it looks quite violent.
Okay.
It looks quite violent because you got to press about 4 to 6 centimeters in. That is about 1/3 of the depth of an average human body.
Wow.
Yeah. Okay.
Yeah.
AED man.
Step
Come on
forward,
in.
Faris.
First thing I'll do is to check for specific dangers that might prevent me from using the AED. Watery surfaces, metallic surfaces, and anything flammable that can ignite.
Okay.
So I'm looking out here, everything's fine, so I'll proceed. Then I'll inform, because I need to communicate with my partner. So I will tell him, AED is here, continue, CPR.
Apply pads to patient's bare chest.
Who is the pads?
So you take the plastic off.
Below the collarbone.
So you have to put the pads while CPR
While
is
the
going
CPR
on.
is going
Oh my goodness, I didn't know that.
Minimize interruption.
Okay.
Minimize interruption, yeah.
Okay.
Apply pads.
So once it's applied,
Insert connector firmly.
all I do is
That's nice that they show you where to put it.
Heart rhythm.
stand clear,
Stand clear.
making sure nobody touches it.
Do not touch the patient. Shock advised.
Shock advice, found a shockable rhythm, everybody stand clear.
Charging.
Stand clear.
Oh, I'm scared.
Me too.
Stay clear of the patient.
Is it gonna happen?
Deliver shock now.
Giving first shock,
Shock delivered.
basically close to about 100 to 120 beats per minute.
At which point do you stop CPR?
So like right now, I'm really tired.
Yeah.
Obviously. So Faris, get ready to take over from me.
Break,
Okay. On the count of 3, 3, 2, 1.
switch.
Wow.
Oh, wow, okay.
That was a very smooth.
Seamless, man.
Seamless.
So you keep doing it until help arrives?
That's right.
Okay.
Whenever someone's in cardiac arrest, either one of two things is happening. There's no rhythm at all, or the rhythm is very chaotic, abnormal rhythm. So when it analyzes the rhythm, it's going to advise you whether it's a shockable rhythm. You don't shock every cardiac arrest. You only shock cardiac arrest which has an abnormal rhythm which is very chaotic that's going on. So you deliver an electrical impulse to reset the chaos. But if there is no rhythm at all, total flat line, there's no shocks to be delivered.
Can I ask Faris and Safi a question? So the last time I had a CPR course was in national service.
Sure.
This was in 2010. How often must I go for a refresher, or is it like a one course to rule them all kind of situation?
Officially, under the national guidelines, refresher course is mandated every 2 years. It's required every 2 years.
Okay.
Okay.
I've got a fun fact for you. So, you know, even as a doctor, I have to go through recertification every 2
CPR,
years.
okay,
CPR.
okay.
And these are the good guys that taught me.
Well, CPR is a life-saving skill which can be put to good use when the occasion calls for it. And what you can do is consider downloading the My Responder app right there onto your phone.
Yep, we hope you've enjoyed today's episode. And don't forget to join us next week as we delve into another interesting health topic.